Today we're going to demonstrate an NIHSS evaluation of a patient. So I have my handy tools here. I have my NIHSS form, which also has the answer definitions. I have my picture cards, my sentences, my words for dysarthria, and then also my NIHSS scoring tips for comatose, difficult, or confused patients. So let's go ahead and get started with Sue here. Hi, Sue. How are you doing? Are you in any pain? Okay, her eyes are open. She's answering my question by nodding her head, indicating she is not in pain. So for the first 1A level of consciousness, I would score her a 0. She is alert. Sue, can you tell me what month it is? Okay, how about, can you tell me how old you are? And I can check her wristband for her age. However, she hasn't been able to give me any answers, so I'm going to score her a 2. Okay, for level of consciousness commands, I'm going to ask her to do 2 commands. Okay, Sue, can you go ahead and make a fist with one hand? Good, and go ahead and open it. And then close your eyes really tight and open them very big. Great. So Sue followed both the commands that I gave her, and notice I was pantomiming the commands, so that can be helpful. So for level of consciousness commands, I give her a 0. Next, we're going to assess her gaze. Okay, Sue, I want you to go ahead and follow my finger, and then follow my finger. Okay, so Sue is not following my finger back, but we can also use our face, so anything of interest to the patient, a badge. So Sue, can you go ahead and follow my badge? Okay, so Sue was able to cross the midline and look over following my badge to the right. However, you notice that her eyes immediately go back to the left. So she has a gaze preference. It's not a deviation because she is able to cross the center, but because she continues to look over to one side, that's a gaze preference, and that's a score of 1. Next, I'm going to assess her visual fields. Now, if the patient can help you by covering one eye, then you go ahead and have them do it. Otherwise, then I would cover her eye. So I'm going to ask her with her good hand, Sue, can you go ahead and cover one eye? Thank you. Okay, and I want you to look at my nose. Now, can you indicate when you see my finger wiggle? Okay, good. She's tapping the bed for me. Okay, look straight at my nose. Look here. Okay, good. I've got to tap again. And great. Okay, good. Okay, Sue, can you go ahead and cover the other eye? Okay, look straight at my nose and give me a tap when you see my finger wiggle. Good. You're doing great. Okay, another tap. Okay, and she's tapping. Good, okay. So you can go ahead and rest your hand there, Sue. So you can, with visual fields, you can use finger counting. I prefer finger wiggling. There's really no difference in doing that. It's just if you have a confused patient, it can just add to the confusion. Are they not answering because they don't understand, or because that they truly can't see it? And then also, if your patient looks towards your finger, so maybe they're not following commands exactly, but they do look toward your finger, then that's an indication that they did see it in that visual field. So you can go ahead and score that. So I got appropriate taps every time for Sue, so I'm going to score her a 0 for visual fields. Okay, next I want to score her for facial palsy. So we'll go ahead and remove her mask here. Okay. And Sue, can you go ahead and show me your teeth? Now normally I mimic this for them. Great. So Sue has very symmetrical smile. If you have any doubt, you can count the teeth. I don't usually ask patients to smile because they're here in the hospital. It's not usually a great situation for them, so I ask them to show me their teeth. So we'll go ahead and give you your mask back. Okay. So for facial palsy, I scored Sue a 0. Next, we're going to move on to the motor for the limbs. So I always start with the good side. So I'm noticing that Sue's moving this side a lot more than the right side. So I'm gonna start with this side. Sue, I want you to go ahead and hold your arm up. I'm gonna count to 10 and I want you to keep it right there for me, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, go ahead and lower your arm. So notice I put her arm into place. So with the NIHSS, it's palm down and we put the limb into place rather than, it's not part of the exam to ask them to raise it up to that spot. So now I'm gonna do her right arm. Okay, Sue, can you go ahead and keep this arm right here? And same thing, I'm gonna count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you may not have been able to see it, but Sue's hand hit the bed, her arm hit the bed before I finished counting to 10. So, and you want to make sure that you're counting in front of the patient. So with a score of 1, it would be if she was drifting, but was able to stay off of the bed. A score of 2 is if they hit the bed before you finish counting to 10. And then we're going to cover the other scores here as we go. So let's again start with her good leg. So I'm going to have you hold up your leg at a 45-degree angle, and I'm going to count to 5. 1, 2, 3, 4, 5. Great. You can go ahead and lower that. I saw no drift. That's a 0. Okay, I'm going to raise up this leg here, Sue, and right away I can tell that she's got no ability to defy gravity, so I'm going to lower her limb back to the bed. Actually, we'll give it a try first. Okay, Sue, are you able to hold this up to 5? Okay, so we'll lower it to the bed, and then next, I'm not done yet. What I need to do is see if she can move it on the bed. Sue, are you able to move this leg? And she's moving her leg there at the knee or at the hip. So because she is able to move on the bed, that's a score of 3. If she was not able to move at all, including with if I gave her some stimulus, then that would be a 4. So next I'm going to assess her for limb ataxia. So again, starting with the good side. Okay, Sue, with this hand, I want you to touch my finger and then touch your nose. Okay, good. Good, very good, okay. And then can you try with this arm? Are you able to reach up and touch my finger? Great, and then how about your nose? Okay. Okay, you can go ahead and rest that arm. I'm not going to try to have her move her leg since she doesn't have movement beyond on the bed. So with this leg, Sue, I'd like you to bend your knee with this leg and put your heel here and run it up and down your shin. Very good. Thank you, Sue. So she showed no signs of ataxia on the left side, which remember we scored as a perfect score. She is strong in those limbs. On her weak side, she looked ataxic in this right arm, but that was due to weakness. We cannot tell if that was due to limb ataxia. So ataxia is only scored if it's out of proportion for weakness. So if your patient is weak in that limb, you don't know if you're seeing shakiness because of the weakness or the ataxia. You only score ataxia if it's proven. So it is a score of 0 in the weak limbs. So I'm going to score her 0 for ataxia, and that is the most commonly misscored item in the NIHSS. So it should be 0 unless it's clear that the patient has ataxia out of proportion to weakness. Okay, and then for sensory, you want to use a safety pin because sensory is different from distinguishing between light touch. So I always explain that you use a clean safety pin. I keep them here on my badge and only 1 per patient. So I will throw this away when I'm done with it. I always explain what I'm going to do to the patient before I come at them with a pin. So Sue, I'm going to very lightly touch you with the pin on each side of your face, and I'm looking to see if it's the same on each side or different. So I explain that I'm looking for, is the sensation the same or different? I'm not asking dull or sharp. Okay, so. Was that the same? She says yes. So then I'm going to do the arms, and remember I don't want to do the hands or the feet in case she has any neuropathy. bit there. Is that the same or different? Same? Okay. And then I'm going to do her legs. Is that the same? No difference. Okay. Okay, great. So I give her a score of 0 for sensory. Next is best language. So I already have an indication of Sue's language ability, right? She hasn't been able to produce any speech. So first I will show her the picture. Sue, can you describe what's going on in this picture? How about on this? Can you tell me what the objects are beginning up here? Okay. So I'm not going to belabor the point. Aphasia is extremely frustrating for the patient, especially in the acute period. So I can clearly see that she's not producing speech. I don't need her to read the sentences. Now, if Sue did have some speech, I could ask her to repeat the words. These words assess dysarthria, and aphasia and dysarthria are not interchangeable. So if she was producing speech, sorry, this was upside down, I would ask her to repeat after me, mama, tip top, 50-50, and I could discern whether she had dysarthria. However, because she's not able to produce speech, the rules on the NIHSS say I will score her a 2. Now for language, I'm also going to score her a 2. And you might be thinking, why aren't you scoring her a 3? She is mute, and it describes a 3 as mute. However, it also indicates that the patient has no auditory comprehension. Sue is following commands, so she clearly has comprehension. She is not globally aphasic. So because she followed commands, but she is mute, that is actually a score of 2. If she had some speech that was not fluent, but I could follow her, then she would be a 1. Now we're going to evaluate Sue for neglect. So for this, first, neglect, you do need to test 2 fields of neglect. So first I'm going to test her visual fields. So Sue, I'm going to wiggle my fingers, and I want you to tell me if I'm wiggling. I want you to indicate if I'm wiggling right, left, or both. Okay. Great. Okay. Great. Okay, so Sue was correct. And for this next step, I need you to close your eyes. So for the neglect evaluation, you want the patient closing their eyes. And I usually switch it all up, so I'm not always going right, left, and then both, because then they're anticipating that. Good, okay. Good, good. So she's getting the answers correct, and I'm switching it up a little bit. Great. You can go ahead and open your eyes, Sue. Thank you. So Sue was able to see when I did both sides, both visually and with touch, and distinguish each side from the other. So she has no neglect. And that is the end of our demonstration. Just want to thank you so much for the great care you provide our patients. Don't forget, you do have tools available to use, and these are found on the Sutter intranet as well. And also, please feel free to reach out to the stroke team at any time. We are happy to help you coach and mentor on the NIHSS.